Yes, I am with Gic Insurance Consultants. We are an independent agency, but we're a lot different than just insurance companies. We do have social services. I have a background in social work, so we were created to not just look at insurance, but also how to understand insurance or Medicare, and to look for options, because it's just one of those things that once a person gets to the age or they're eligible for Medicare, sometimes it can be a little confusing. You'll get that book in the mail that'll say, "Welcome to Medicare," and that's it. It's about this thick, I think, and it's a lot of reading. So what we try to do is simplify it. We will meet with clients. We will go through it. We'll show them what they can do, how Medicare works, and then also explain a few things to them, and then help them if they want to find an insurance. But we'll talk a little bit about that in a minute. Okay, so give me a second. I'm going to try to get on the slideshow. This is supposed to be Medicare tune-up. So I'm going to talk a little bit about Medicare, talk about how it works, some of your options, and then also unfortunately, Medicare has not come up with the numbers for 2022, but I found a few things that I can sort of explain to you, and then I guess I'm in the same boat as everybody else right now. The last word of this morning, because I checked on it this morning, is announcement should be made sometime in November. So we're sort of keeping an eye on that. So give me a second. Let me see if I can get my screen going. Can you see the slideshow, Sheila?
Yes, we can.
Is it with notes or is it just a slideshow?
It's with the notes. So you just need to, at the very bottom, there is a little.
Again, like I said, all right, there you go. So this is actually called I would call it Medicare 2022 because there's a few changes, but not much. So just to touch on eligibility for Medicare. Most of us, at 65 or older, once we've worked the 40 quarters, we're eligible for Social Security. And that's standard just for, regular getting to that age of 65. If you're under 65, but you've been deemed having disabilities for at least 24 months, on the 25th month, you will also automatically get Medicare. That has to go, that's once you've gone through Social Security and gone through the court process, and they finally say, okay, yes, you do have disabilities, then you are, and you're under the age of 65, you do qualify for Medicare. Another way that you can qualify for Medicare is if you have end-stage renal disease or amyotrophic lateral sclerosis. Now, it took me a long time to learn to say that word. Okay, I had to Google it like 100 times, but that's a long way of saying ALS or Lou Gehrig's disease. All right, so those are the three, I guess, criteria that you can have, that you would need to have in order to get Medicare. So your initial enrollment period is if you're 65, and this is a question that's come up a lot for me, and so I did a lot of verification, made sure we got this right. Say you're 65 and you're currently receiving either Social Security, from retirement, or if you've maybe retired early, if you've been receiving disability. No, I'm sorry, not disability, but say you're getting SSI, and when you turn 65 and you're already receiving benefits, you will automatically start getting Medicare at the age of 65. And normally you will get a card, the Medicare, the red, white, and blue Medicare card, about 3 months before it's supposed to start. Okay, so your birthday is coming up in May, and so about March, you should be getting your card. Now, if you're under 65 and disabled, like I mentioned earlier, that means that you have already been deemed disabled by Social Security. It'll be automatic. You don't have to ask for a card. You don't have to register. It will come to you about 3 months again before that 25th month starts. So, you've been going on month 24 of being disabled, then you'll get that card. Now, sometimes when a person is deemed disabled, Social Security will say you go to court and it says that you have been disabled, like they'll backdate it. And so it may not be the total 24. I know it's a little crazy there, but if you're in that situation, the best thing to do is look at your award letter from Social Security, and it'll give you an idea of when your Medicare starts. Now, say you're 65 and not receiving benefits. So I'll use an example. I turned 65 in May. So in March, I have to get online, call Social Security and tell them, hey, I'm turning 65, give me my Medicare. And that's exactly, when you can do it. You've got like at least 3 months ahead, I would say, to do this. And it will start the first month of your 65th birthday. And you get your card once you register with Social Security. So that's the big difference. If you're getting benefits, you don't have to do anything. If you're not getting benefits, because like me, I'm still working, I have to go online or call Social Security and tell them I'm ready. Okay, so we need to do that. Now, if you do have ALS or Lou Gehrig's disease or dialysis, usually you can apply with Social Security. I have individuals that are on dialysis, and the place that they go for dialysis usually has a social worker, and they will apply. Now, there's no waiting period for that. It usually starts that same month that Social Security awards it. And because it's such a dire need, it's usually within the 30 days. Okay. Now, say you didn't sign up during your initial enrollment period. And like I said, your initial enrollment period is at your 65th birthday. So what do you need to do? That's a question that comes up sometimes. I missed it. I was working and I didn't pay attention. So your Part A, that is for your hospital. And we'll go a little more into that in a while. But you can do that anytime during or after your initial enrollment period. And that goes back, and it can go back. So say I missed it in May, I go in with another few months before, but 6 months from May, so November, they will actually go back to May. So they give you like a 6-month period where you might forget to do it, and they will go back. And if you've had any kind of hospitalization in that period, Medicare will help pay for that. And you will get charged for every month that, no, I'll take it back. Let me step back on that. There is normally no monthly premium for the Part A, so it should be okay. But, it would help you out by doing that. So if you forget, that's okay. Now the Part B, that's a little bit more complicated. The Part B is what covers your medical. Now, some people opt out of Part B when they are eligible to get Medicare. We always tell people, let's look at your options before you do that. Because say you do opt out of Part B, what happens, there's only one period after your initial enrollment period. So you missed that 3 months after your birthday and you didn't do it. The only time you can apply for Part B in that case is between January 1 and March 31st of every year. So for example, right now, I want Part B. I will have to wait till January to sign up. And the Part B will not go into effect until July. So we're looking at close to a year without any kind of coverage. So we always tell people when that Part B comes and you get your card and you're not sure if you want to pay the premium, which we'll talk about in a minute, let's look at options. There may be ways to help you pay for that Part B. So that is the only thing. So don't give up that B if you don't have to.
Gilda,
yes, ma'am.
Can you go over more of what the Part B covers?
Yes, I'll do that in a minute. I've got another slide, and I'll talk a little bit more about that. Now, definitely, because it is very important. Another thing about your Part B is if you do not do it, like I say, if you do not sign up for your Part B during that initial period, which again, your initial enrollment period is actually 3 months before your birthday, and then the month of your birthday, and then 3 months after. So you didn't sign up in that period. What happens is then Social Security will deduct, they actually penalize you for every month that you did not sign up in your initial enrollment period. So we always say, look, again, I'm repeating myself, but it's very important because we've had quite a few clients that at that time they didn't know about it and they opted out of not having Part B. And then when they really, really need it, it winds up costing them, because actually that penalty is 10% of whatever the premium is for every year you're not on the Part B. So say for this year, it's $148.50. So if I didn't do it for this year, it's my turn, and I didn't do it next year, my premium will be $158.50. Right. No, another four. No, I'm saying it'd be actually more because it's 10% of the 148. So it'd be another $14.80. And the thing is that penalty will go with you for the rest of your life. And that's a penalty that you have for every month. So we'll talk a little bit about that. There are options and we can help you look for those options. Okay.
Gilda,
Yes.
it's Beverly.
Hi,
I just
Beverly.
wanted to add that, hey, whenever you are continuing to work past the 65, because that's what I have done, it does get different.
Yes, you're right. You're right. If you are covered, if you have coverage, and that's the same about no longer working or loss of coverage was the next one. With that one, you're absolutely correct. If your insurance company, you are covered with the called credible coverage, and you have, where your insurance is covering your doctor's visits, whatever you have, you will not be penalized. You're absolutely right. And so but what I'm saying is for some individuals that aren't working, they wind up not, they feel like they can't afford that premium and they'll opt out. But when they actually need it, it makes it very, very difficult. I mean, it can get expensive. So
Definitely. I encourage everybody that needs to get signed up.
yes, definitely. And I always tell them, get your Part A at least when you turn 65 and you're still working. But what we do is we actually compare and we try to figure out, is it better for you to just stay with your current coverage, or do you need that Part B? And if they don't need the Part B, they opt out. And then once they do retire, or they're no longer working, and that's what's the thing is no longer working or loss of coverage, they actually have 8 months from the time they stop working or their coverage is over, and they will not be penalized. So it can get complicated. And that's why we try to keep up with these things. And when we talk to individuals, we say, okay, what is your situation? All right, let's look at this and let's see what we can work out. But you're right, Beverly, it's can get so complicated. And there are times that they don't need to have the Part B because they've got really good coverage. And then another thing is I always encourage individuals that are still working and they're on Medicare to speak to their HR and their insurance people, because some I found, I know you're with BAMC, so you're with federal, right? But there's some companies or some individuals that are working and their insurance finds out, their work insurance finds out they have Medicare and they want them to have Medicare. And so they'll have to get the A and B. The same goes with some individuals that are on TRICARE. They need to have A and B. So it's always good to speak to your HR people when you're getting to 65, whether or not you're going to be working. Talk to them and say, how does my insurance work with Medicare? Because if not, it can become a mess. I've had people in the past say they were on TRICARE and they said, oh, I don't need Medicare, I have TRICARE, and they would opt out of the Part B and then get dropped by TRICARE. So always speak to your HR people, always speak to your whoever's in charge of your insurance if you're working, because it can get sticky. Okay. So like I say, if you're no longer working or you lose your coverage because you lose your coverage because you've stopped working, you actually have 8 months to from the end date of the job or your coverage to apply for that Part B. And in that case, you can do it anytime throughout the year. And it'll start as soon as they approve it. And I've had people get started on their Part B within 4 weeks. So it's just keeping an eye on it. Okay. Any more questions? Thank you, Beverly. Thank you for pointing that out. It's really important to know that. So this is about original Medicare. This is what you were saying, Sheila. Okay. So your Part A hospital, I'm going to just go over that real quick. The Part A, you get your red, white, and blue card, and you have your Part A and you have your Part B. The Part A covers your hospital, and that's if you're in hospital services. It'll cover, your tests that are done there, any kind of things. It'll cover a semi-private room and certain things like that. You want to make sure Medicare doesn't cover everything, but it does help with some of the costs. Okay. The Part B, that's your medical, and that is your outpatient care and your services. That's your doctor's visits, your specialist visits, durable medical equipment, oxygen, wheelchairs, that type of thing, and tests. I think, they're covering most of those, that covers most of those things. Now, the thing about your hospital, the Part A, there is no monthly premium, but there is a deductible. And I think for this year, it's about $1,400 that you will need to pay if you're in the hospital, whether it's 1 day or 60 days. And that's the deductible. Okay. I tell people Medicare doesn't pay for everything, but it does pay for a lot. Now your Part B for this year, the deductible was $203. Once that deductible is paid, then Medicare pays 80% of all costs. Medicare, I take that back. It's not all cost. It's Medicare approved costs. Okay. So we're not, we don't have the green light for everything. Medicare has certain rules and things that they cover. So whatever you do, you want to make sure, especially if you're on your traditional Medicare or just the red, white, and blue card, be aware that every year you're going to have an annual deductible, and then you have your 20% cost. Another thing is the Part B, there is no out-of-pocket maximum. So it doesn't matter how much you spend throughout the year, you're still paying that 20% once you meet your deductible. Okay. Now, all right, so I put this in here with expectations, the 2022 Medicare premiums, with expectations when I created the slide that we were going to have something to put in there. And like I mentioned earlier this morning, I double checked, and there is still nothing from Center for Medicare and Medicaid. There's a lot of speculations and, some from a lot of different avenues, and they're really expecting the Part B premium, which this year is $148.50, to go up as high as $158.50. Okay, no announcement on there's normally no premium for the Part A, so that's going to stay the same. But the Part B, they're expecting, especially with the cost of living that's coming up, everyone should be getting a cost of living raise that has Medicare. Social Security. So they expect Medicare to go up too. But the last I read this morning was hopefully by the beginning of November, we'll get an accurate amount of what they'll be charging us. Okay. All right. So I did find some new Medicare services. There's it's basically the same as before. But they are adding a couple of new services that they didn't have last year. They will be doing some bariatric surgeries. Of course, it has to be medically necessary. Someone has either diabetes or some kind of other underlying, medical condition that the bariatric surgery will be helpful to them. Of course, there's a lot of red tape that needs to be done, but at least this year, it seems that they're opening up that avenue for people, that it could be an option for individuals, especially if they're having a lot of trouble with their diabetes and issues like that. Another new thing is the cognitive assessment and care plan assessment. I had no idea that it wasn't considered before. This is going to be good for doctors. Now, physicians will be able to do some kind of assessment for their patients to sort of get an idea of whether or not maybe there's, the beginnings of dementia or Alzheimer's. Whereas in the past, this was not included with the coverage of Medicare. So they're opening up, again, some new services to individuals, which I think this is going to be very helpful, because in the past, Medicare wasn't covering these assessments. So, and I understand that what I read was the doctors may even do they do a real quick assessment while you're there in the office, but this provides the physicians to do a separate kind of assessment rather than just during your regular, doctor's visit. They're doing the blood-based biomarker test now. They've approved that, which will come in handy for individuals that maybe there's a little bit of a concern with the, I have to admit, I had to look up what a biomarker test was, but from my understanding, it should help with some maybe possibly cancer, other things like that, sort of preventative. It looks like they're expanding their preventative services. So this is really going to be helpful to a lot of individuals, and it won't come out of your pocket. It'll come out, Medicare will be covering it. Of course, COVID and everybody's mind right now, the vaccines, diagnostic tests, the antibody test, and the I should have Googled how to say that. The antibody test is also included this year, which I'm glad, because some people were being charged, and a lot of us were not, but this way we know now, I guess it's to let us know Medicare is going to be paying for these tests. So those are the new services so far that I've seen that are coming up. Now, services not covered, you're probably aware of these things, but it's most dental care. I mean, it will cover cleanings, x-rays, fluorides, but other than that, if you need anything, it doesn't cover it. Dentures is not covered. Eye exams, if you need for glasses, it will cover for cataracts and glaucoma, but say if you need a routine eye exam, Medicare does not cover that. Cosmetic surgery, massage therapy, that sounds good, right? Massage therapy, but they don't do that. Also, routine physical exams. That was interesting when I read that. It'll pay for you to see your doctor if you're not feeling well, but if you have a routine physical exam, that was not actually covered in the past, or it still is not. If you need a hearing aids, exams, fittings, that's not covered by Medicare. And I'm going to cover something in a minute to sort of help you with that. And of course, long-term care, if you need to be in a nursing home, that is something totally different. Usually Medicaid and the state steps in to help with that, or if you don't have private long-term care insurance. And then concierge medicine, that is sort of new in the last few years. I found that interesting, but that is not covered. Okay, so before I talk about what can be covered, the Medicare options, and this is sort of what we come into, and it sort of helps, is the education. And I know I may be just repeating some things that most of y'all know, but I just wanted to touch on it. Now, say you do have your Medicare, and of course you have your original Medicare card, the red, white, and blue. If you have Medicare, one of the things I don't know if you noticed, Medicare does not cover your prescription drugs. So in that case, you would have to purchase a Part D prescription plan. And usually, not usually, but they are plans that you can buy from independent insurance companies. I think the last time I looked, there's quite a few in San Antonio, but we're talking about United Healthcare, Humana. Everybody sort of has these individual Part D prescription plans. So if a person decides that they do want to just stay with their regular red, white, and blue traditional Medicare, you would need to purchase the Part D plan to help you with your medications. Now, another thing, that's another one, if you decide you don't want to do that, you have that option. However, when you do go back and you do need the prescription, the Part D prescription plan, after 7 months, they will start penalizing you. So again, that you always want to look at your options. I say some people that I've spoken to may not know that there are ways of helping them pay for their Part D and things like that. That's where we come in. Now, say a lot of people say, well, I want a supplement. Now, a supplemental plan, it's different from an Advantage plan, and I'll explain it a little bit in a minute. If you wanted a supplement, you would need to pay, of course, you've got your original Medicare. And again, that's your premium. You're paying your original Medicare. You would add the Medicare supplement. And then you would also have to add a Part D prescription plan, because the Medicare supplements do not cover any kind of prescription meds. Medicare supplements usually cover that 20% that original Medicare does not. Remember I said your cost would be 20, Medicare covers the 80. Medicare supplements usually cover, depending on the plan, there's quite a few plans out there, but they will usually just cover that 20%. Now, Medicare supplements run anywhere, and those again are by independent insurance companies. And they can run, I spoke to someone yesterday, and they can run as low as $40, but they go up to $600. So you're paying your Part B premium, as they will say, the $148.50, and then your Medicare supplement, which let's say we'll lowball it and say $200. And then your Part D prescription. And those usually run, I understand they're going to go down this year, but those usually run an average about $40. So it can get a little expensive, but some people might feel that they need that, because it gives them a little bit, in some cases, it does give you that option to go just about anywhere. And some people don't want to have to worry about finding a network doctor and that type of thing. So that might be an option for people. I had a young lady that actually she was going to New York for treatments, for cancer treatments, and that's what she chose to do because she could go all over the place. So that's one option you have. And then, of course, you have the Part C Medicare Advantage plans, which right now on TV, if you watch television, it's probably every other commercial because this is open enrollment. Annual enrollment period. The Part C is the Advantage plan. And what the Advantage plans do, those are also independent insurance companies, your United Healthcare, Humana, Blue Cross Blue Shield, whoever has these plans. This year, there's like 38 plans in Bexar County alone. I think it's expanding next year. I haven't had a chance to check the numbers yet. But what these Advantage plans do is it combines your original Medicare and the Part D prescription together. So you're only paying for in some cases, you're only paying that $148.50 for your Medicare. But what they do is they join it together. You don't have to buy a separate Part D prescription plan. And these Advantage plans also have you don't have deductibles in most cases. You don't have, you have a set copay, and they also have added, I guess advantages is the word for it. Added benefits that Medicare doesn't cover. Speaking of that, let me show you. Okay, remember I tell you about the most dental care that are not covered. Some of the Advantage, and I say some because there are both HMOs out there and there are PPOs out there. And HMOs usually have to get referrals. PPOs usually can go wherever the doctors are in network and accept the plan. Okay, but those plans, most of them have dental care. And in some cases, they will give you benefits to help you pay for the dental care. They will cover dentures. Now, that was something about 2 years ago, Medicare approved for these plans to cover dentures. So that's come in very handy for some of my elderly that have been without, teeth because of issues for years. Now they can eat without the problems. They do provide some routine eye exams, and some of the plans will give you some benefits to help pay for your frames and your lenses. Routine physicals, that's something that everybody, and they encourage that for everyone to have that routine physical every year to make sure you're on task and everything is going well. It's always good to get a tune-up. I guess I call it more of a tune-up. And most of these plans also have benefits such as hearing aids, and they will cover the exams and fittings. Okay, so if you ever have questions about that, you can let us know. We can sort of look those up for you. So when can you sign up for these plans or your Cs? Okay, this is your plan enrollment period. Like I mentioned, you have your annual enrollment period. That's now. That's why every other commercial is an insurance company telling you, you call us, we can help you with that. That's from October 15th to December 17th. These are for individuals that they're new to Medicare. They waited for, they were on Medicare, but they didn't get on a plan. They are on a plan and they want to try something different. This period is when you can sign up. Now, the only thing is that the plans do not start until January 1st, but it's a good time to sort of look at your options. Look and see maybe this plan, because they do change, plans do change every year. And it's always good to see, what is out there for yourself. And then also sometimes doctors may change networks and your doctor is no longer with the network you were in right now, but we can look to see if maybe they're on another plan and we can help you find that. Okay. This one, a lot of people don't know, but say you've missed your annual enrollment period or you signed up during annual enrollment period, there is actually an enrollment period in January. And that starts January 1st and it goes on to March 31st. What happens there is that you're already on a plan, you don't like it, and you want to change. You want to go back to where you were. This is also a time when you're on a plan and you want to go back to Medicare. This is a time when you can do that. And in this case, say you do this in January, in February, you'll be back to where you want to be. Okay, so this is the open enrollment period and it's a very short time, but and some people don't really talk about it, but it's there. So it gives the clients, it gives the patients an extra period where you can make some changes if you didn't like where you are or something happens. Like I say, sometimes the doctors change from one network to another and they find that they're no longer taking a certain plan. We can look to see, okay, what do you take? And we can help you get on that one plan. And then we also have the special enrollment periods. Those are for individuals that that's throughout the year. Okay, that is anytime you have maybe been recently diagnosed with something chronic such as diabetes or a heart issue. Medicare will actually allow you to change from, say, you're on a regular plan or regular Medicare, and then you've maybe had an issue. You've been recently diagnosed with diabetes. And there might be a plan out there, and there are quite a few chronic plans out there that will provide more help for you. I mean, some of the chronic plans out there actually will even help pay for things like your diabetes monitoring, your equipment. So there might be some options there. So if, say, you've been recently diagnosed with something new, whether it's heart or diabetes, you can speak to someone and be placed on a plan. Say you're new to Medicaid. And when I say Medicaid, that's either regular Medicaid and Medicare, or the Medicare Savings Program, which I'll talk about in a minute. That is something that helps you pay with your Part B. Say you become new to that, you can actually get on a plan at that period of time. And these are sort of like, actually, enrollment periods are strange and we look them up. So if you ever have any questions, my number is going to be at the end. You can call Sheila. She's got my number. We can always look them up and say, hey, you can do this. If you've moved from one area to another, we were talking to someone yesterday at Schulenburg. They were in San Antonio. They moved to Schulenburg. Well, their insurance isn't covered in Schulenburg, so we're able to move them now. And the good thing is they don't have to wait till January to start. They will actually start November 1st. So there's all these different options that you have, these different things that sort of Medicare is sort of crazy, not crazy, that's a bad word to say, but it's complicated sometimes. So that's why we're here to help you with that. So who are we? This is, I guess that was my intro to what we're saying, what I was talking about. We are licensed insurance brokers. We are contracted with quite a few insurance companies. So when we go in to see somebody, we don't say, oh, here, this is the best plan. We work for our clients. So we look at what you have, what you need, and then we have that added advantage that we're open to different plans out there. So that is one of the advantages that we have. So like I said, we are here to work for you. Social workers, like I say, I have a master's in social work. I did not intend to do this when I first started out doing insurance, but I saw the need. And then when this company was created, we saw how insurance worked and things, and we knew there was a need for people other than just insurance. It's not just insurance, it's a sort of a holistic type of thing. If someone needs that, well, maybe they need something else. So we are social workers, and we look at everything when we're doing that. And we do have, okay, we're aging. I'm giving you my age here. No, we do have over 80 years of combined experience in service. We've worked in different social service agencies. We worked with the disabled population. We've worked with senior population. We worked with everyone in San Antonio. So we do have a lot of experience, not only with the insurance, but with social services. And we're very lucky to be connected and been able to start working with agencies such as Connectability, because it's opened it up for us. And I know that if I have a client that needs help, I can call Sheila, or I can call someone else at Connectability and say, where do I go? What do I need? And I hope she feels that she can do the same thing for us. Well, my dream is that we work together rather than work harder. And I think that's a social worker in me, is let's work together to help our clients. So we do have a lot of experience. And if we don't know it, I'm smart enough to say, well, I don't know, but let me find someone that does. And then I pick up the phone and call Sheila. So that's what we do. So how can we help? Again, I'm probably repeating myself. We do provide a no charge needs assessment. So we sit down with a new client and we'll say, what is your needs? Who are your doctors? What are your medicines? What do you need more than anything? And we look at all of that. And then we look again at insurances and see what is best fits them. We do the extra help application. So this is what I was saying about the Medicare Savings Program. And people looking at all their options. So some people will say, I can't afford that Part B premium. I can't afford that $148.50 could come out of my Social Security. I just don't have it. So what we do is we assess, and there are programs that may help pay for that $148.50. And it is a state program. It is with Medicare, Medicaid, but it is specialized Medicaid only for people on Medicare. But not everybody knows about that. And when someone gets their Medicare Welcome to Medicare book, it may touch a little bit on there is help out there, but it doesn't really explain what to do. What we do is we assess it, we look it up, and then we will actually help the clients fill out the paperwork. We send it in, we keep an eye on it. We call every few weeks to make sure that Texas Health and Human Services is working on it. And then once the individual or the client is approved, we actually keep an eye on it for the following year, because this kind of program you have to apply every year. So we keep an eye on it. And when it comes time to start up again or to renew, we will call the client and say, hey, it's time, let's do it. So our goal is to make it as easy for our clients as possible. And so there's no gap in there, because, if you don't do it, then all of a sudden you go to the bank the following month and guess what? There's $148 missing from your check, which can cause some havoc. So we definitely want to keep an eye on that. Another program that's out there is a program that may help with the prescriptions. Again, it's income-based, but if a person qualifies, we will do the application for them, and that can lower their prices, their prescription prices to as low as $0, $3. And these name brand, especially, which has become very helpful to our individuals that are on insulins. their insulins will go down to about $9.80. So that has become a lifesaver for quite a few of our clients. But again, they weren't aware of it. So we're able to apply for those programs and get that help that they need. And that's what we like doing. I love doing that part. And again, I said, we research and compare plans. We will, once we get the needs, who are your doctors, who's the most important doctor, because not all doctors, physicians will have the same plan. And then we'll go that route. We'll look at the medications, and then we'll say, okay, this is what we have. Whatever we find, we come to the client and we'll say, okay, this is what we found. Which one do you want us to help you get on? So like, it's not us coming in and saying, you need to be on this one. This is what your needs are. And again, we provide ongoing assistance to our clients. We're always there for you. We tell people you can call the insurance company in the back of the card. They're in another state. That's great. And they're very helpful. But we do a lot of research. We will verify. Our clients need a dentist rather than going online. They'll call us, and we've already verified. And some places they'll give you a list of doctors you may go to. But things may have changed. The doctors don't take the plan anymore. We will actually call the doctor's office and verify before we give you the information. We don't want you to waste your time and effort. So we put a lot of work into what we do because we understand that it's important. It's important. And I guess that's the social workers in us is not just insurance. It's about the needs of our clients. Like again, we say, we work for you. And this is us. This is Gic Insurance Consultants, and this is our phone number. We are here. We do have an office here in the medical center area, but most cases we go to our clients. During COVID, we learned to do everything online, but we still go out. We take precautions. We all have our vaccinations, and we take our our masks and everything. We take whatever precautions we need to for our clients. So that's us. So let me see, stop share so you can see me again. Any questions?
I have a few here. So when you were talking about the age in which you qualify for your basic Medicare, does that depend on when you were born?
But it's on your birthday. Yes, it's the month of your birthday.
I meant,
okay, go ahead.
Yeah, like when I checked for mine, I was supposed to be 66 and a half or something like that.
No, that's your retirement. That's your Social
retirement.
Security.
Oh,
yes, that can be that can be confusing. I recently looked into that. That is when we're allowed to retire, right, and get our full amount. But at 65 is when we still have to do our Medicare. So, and unless like Beverly said, you have some coverage, you do want to let them know. I would still call Social Security and say, look, I'm opting out because I'm still covered. You can get your Part A, which will help you sort of with your insurance. If you say you're already covered with somebody, that will help you with your hospitalization. You don't have to get on Part B at that time and not have to pay that premium. But, at 65, you definitely want to make sure you do that, especially if you're not receiving any kind of benefits, because they're going to look at, say when I turned, okay, I'm a good example like you. I think I can't retire till I'm 66 and 7 months or something like that, whatever. If I wait till 66 to get on Medicare, I'm going to have to pay another 10% penalty. So at 65 is when you need to go into Social Security, talk to them, and then that way they know, okay, you're covered. We're not going to worry about you. You're good. But yeah.
And that penalty adds up because it's the penalty for that and the penalty for the Part D.
Yes.
So
the Part D, I think it's like 1% for every month after the 7th month. The Part B is 10% for every year. And I know I had an individual that I guess he was in his 80s or he was getting late 70s, and he had opted out of Part B. And when he needed it, I think his Part B premium was over $300 a month. Yeah. And like I say, and that's for the rest of his life. So That's why I tell people before you opt out of that B, talk to us. Let us look. Let us see if you qualify for that extra help. We'll help you apply for that extra help, because it may be that you don't have to worry about paying that 148 or 158 if that's what it becomes next year. We can help you do that. So you have that choice, and you have that 3-month period to make that decision. So I would contact us. We'll look into it. We'll we can look at your income, and then look at what the limits are for this year with Medicaid, or Texas Health and Human Services is what it is, and we can fill out the paperwork for you. And actually, little secret, we have a short form, which you can do it online, and it's this long form, but we are able to do a short form application, and they accept it, and it usually goes a lot faster. So we can help you with that.
Okay. And so we have a question. So how is the money taken out of Social Security if you don't get enough to cover the 148 a month?
They'll charge
I
you.
have
Mhm.
all 40 quarters,
Mhm.
but fall into the WEP, Windfall Elimination Program,
Okay.
because I receive a pension. Will I get billed separately from Social Security?
Yes. You have that option. You can be billed separately, or they can take it out of your check. And in most cases, most of our clients, they are taking it out of their benefits. But I do have a few clients that don't, they're still working. They're not, they have the Medicare, but they've chosen to wait, until they get to that, the actual retirement age, I guess. Now you have your early retirement, your actual retirement, and then the extended one that you have that you get even more money. But those individuals, they get billed, and they'll bill you either, and that's something you would contact them and let them know. They can bill you, they can take it out of your bank account. I would suggest letting them know you want it. I mean, some people will pay the 3 months, because usually they'll bill you 3 months in advance. But as long as you tell them that you want it monthly and make arrangements, they'll take out of your checking account, or you send it in every month.
And that also doesn't come, it comes from Medicare. It
What's
doesn't
that?
come, it comes from Medicare and not the Social Security
True.
Administration.
Right.
Because that's what I do.
Yes.
Since I'm working, it's more beneficial for me to continue to receive my Advantage plan coverage than it is. It's less expensive than it is for my work coverage.
Yeah, it is. And in some cases it is. We have individuals that'll do that. I mean, we actually compare. We'll sit down, and then there's times that I've sat down with people, and they'll say, "What, you're not going to sign me up?" And, well, because you're good. You're good. Stay where you are. Don't move, because it can get very complicated, and that's not what we're about. That's not what GIC is about. We're about finding good options for you if you need them. If you don't, we're here to say stay where you are. Be very careful, especially right now in this time of year. It can get tricky. People, just in talking to somebody on the telephone can get really tricky. Don't say or yes when they ask you, doesn't that sound good? Just be very careful.
Okay, and then another question that came in is, how much does your service cost after the assessment?
Nothing. We don't charge. We get paid. I know people look at us like, what? No, we get paid by the insurance company a premium. Not a premium, but a small amount every month once we sign somebody out. But that's not what we were created. I mean, that helps us keep doing what we're doing. But there's a lot of times that we will sit down with an assessment with someone, and this is the way we look at it. I sit down with somebody, we go through the assessment, we find options for them, and then they say, I'm gonna stay where I am. Cool, that's great. That person will turn around and tell somebody about us. And that's how we get paid. And I guess you see that it gets paid back. We get paid back for good, hopefully good work. But we do not charge for our clients.
Okay, so if you have TRICARE, can you get an Advantage plan when it's time for Medicare, or is it Medicare? You have to do the traditional Medicare plan with TRICARE.
You can do both, actually, and it just depends on the person. I have a couple of individuals that have TRICARE, and some of the insurance plans, what they did this past year, and they're doing it for next year, is they have special plans that for individuals that are military or veterans. And it doesn't include your drug plan on it, but it gives you other benefits. So it doesn't work with TRICARE, but the individuals that I have on those plans, they opted to get on there in case they wanted to get, say, a second opinion. They wanted to go outside to someone else. Plus, there's added benefits. I had one gentleman that wanted it just for the gym membership, so it just depends on the person, but you can have an Advantage plan. Plus, there's a perk to those plans too. Some of those plans will actually help pay part of the Part B for individuals. So it's only for individuals that are veterans or, have TRICARE, but they're, you can have one. So again, it's like we sit down with you and look at it and compare and say, is this good? You want, some people want that second opinion. Individuals that are going to the VA all of the time, but they want that option to go out and it doesn't work. Medicare Advantage plans and even Medicare does not work with VA benefits. They just don't, but it gives people that opportunity to find maybe a second opinion or somewhere outside. And like I say, again, like some of these Advantage plans have added perks that some people, like I say, gym membership with that one gentleman, he said, hey, cool, I get to go to the gym now for free. So there's all these really cool things about them.
I have a question about TRICARE for Life. I'm a TRICARE for Life, and I have both of these seen on the military base, and if they can't see me on the military base, they send me out to the civilian sector.
Mm-hmm.
And but most of the time, if I'm seen on the military base, can I also, if I wanted to get a second opinion, can I go outside and then use Medicare on that?
Yes, sir. Yes,
Okay.
sir. You
All right.
can. Yeah, as long as they accept it. As long as they accept it, you can.
Yeah, that's the first thing I asked them. Do they accept both
Mhm.
Medicare and TRICARE for Life?
Yes, sir. Yeah, you should be able to go anywhere that they do. Mhm.
Okay.
That gives you that option. That's really cool because I've had people where I say, no, I've got VA, and then spouse will say, we want a second opinion. We're going to get it. So it's
Right.
so it I think it opens up avenues and options for everybody. So that's a good thing. Mhm.
Okay, good. Okay.
Thanks.
Thank you.
And when you use your Medicare to go out to your second opinion, use your TRICARE as your secondary so that you
Yes.
don't pay as much out of pocket. So when
Yeah.
you go outside of the military, make sure you let them know you are TRICARE, so
Yeah.
they can bill TRICARE that other part.
Definitely.
Okay.
You want to get that. Remember I said there's that deductible, and the 20% is what you would be responsible. TRICARE should go in and help with that.
Right. Yeah, 'cause I usually let them know that Medicare is my primary and TRICARE is my secondary.
Yeah.
So I have used it, and so far, it worked out pretty good.
Great.
Okay, and another question came in. What information do you need for an assessment?
Well, basically, usually we'll say, do you have Medicare? Are you going to start with your Medicare? Who are your doctors? What are your medications? Again, what is the most important doctor for you? That type of thing. Also, we ask about income, just not because we're nosy, but because we want to make sure that to see if you qualify for the extra help. And I always tell people, some people will say, well, I didn't qualify for that extra help in my Part B, but the thing is the extra help with the prescriptions has a different income limit. So we look to see, do you qualify for either one of these programs? And if you do, let's apply one or the other or both. We will do those. So that's where your income comes in. But usually that's it. That's all we need. And you can either call us and we can do an assessment over the phone. You can come to our office. I can go to you, or we go to you and chat and just get that information, and then get back with you after we get that information, and then go from there.
Okay, And if you have Medicaid, can you get an Advantage plan, or do you have to have the traditional Medicare?
It has to be Medicare and Medicaid. Okay, Advantage plans, the Advantage plans, those are strictly for individuals that have some kind of Medicare. And individuals usually that have Medicaid, like I say, usually I don't find too many people that have Medicaid, just traditional Medicaid. But if they do, as soon as it might be because they've been on disability for so many months, right? But they still haven't received, I think it's ISSI. They're not making that much. I think it's less than 800 a month is what they're getting as far as benefits. They have Medicaid. But then after the 25th month comes in of being disabled, all of a sudden they'll have Medicare too. So we can help them with that. But if there's any questions, again, let us try to figure it out. We can try to figure it out.